Hey everybody, welcome to PermanenteDocs Chat. I'm Alex McDonald, and I'm really excited to talk with one of our nurse leaders from Colorado, in the Colorado Permanente Medical Group. So starting tomorrow, May 6th through 12th is Nurses Week, so we are celebrating our nurses today. I'm really excited to introduce our guest, Paul Faulkner, who is a nurse with a variety of clinical experience working in Colorado, as well as one of the professional development consultants there too. So we're going to talk about all things nursing this week. So if you have questions during the chat, please feel to drop them in the Q&A box. If you're on Zoom, if you're streaming on Facebook, feel free to drop the questions in the Facebook chat as well too. So let's just jump into it. So Paul, thank you so much for joining us. Start by telling us who you are and what you do.
Sure. So look, first and foremost, I'm super gracious to be here. Incredible opportunity, amazing platform, representing nursing. It's amazing. So thank you for having me. I'm a registered nurse, as you said during introductions. I've been a registered nurse for about 14 years. About 10 of those were inpatient. I'm from Tennessee. If there's anyone out there in the audience going, I hear an accent. So I'm originally from Tennessee. I moved to Colorado about 6 years ago. My first 10 years in nursing were pediatric ICU and ED, emergency department. And then my last 5 have been with Kaiser Permanente, Colorado. And the last 2 in that role that you suggested, that professional development consultant. And I think for the sake of everyone listening, Dr. McDonald, let's go PDC. It's just easier. Trust me on the ears. PDC. Do you want to talk a little bit about that role, or how would you like me to expand on that?
Sure. Well, why don't you tell us a little bit about, so you can tell us definitely about some of the PDC role, but also about, again, a little bit more about your background and how you became interested in nursing too, because, nursing is a huge field, and there's so many different types of nurses as well too. So maybe tell us a little bit about how you got into nursing and what kind of attracted you, and then also your role as the PDC. Did I get that right, PDC?
Yeah, you did, man. You knocked it out of the park. So I feel like when you're in healthcare, you're influenced, right? Whether it's parents, aunts, uncles, a friend whose parents were physicians, maybe a parent that's saying, you're going to be a doctor, I'm a doctor, whatever you feel. It's the same thing for nursing. I feel like over the last 10 years, I heard that over and over again. Well, that wasn't the case for me. I come from a family of engineers. So mathematics versus science, don't even put those together, right? I mean, come on. So the dinner table wasn't about nursing. My junior year, and I got to tell you, if you were going to ask this question, I was timid on answering it with a personal story, but we're on just facts. Let's let the hair down and just talk about it. That's what I'm saying. Let's give the audience what they want, right? So for me, I was a junior in high school, completely unclear on what I wanted to do with my life. And my house caught fire, believe it or not. And I was at work. Yeah, my sister was severely burned. My mom was burned. I spent probably 6 months of that year intensive care burn unit, and just spending time with my sister during healing. And the one-on-one I saw with nurses, it changed my life. Like, I thought to myself, there's my passion, there's my goal. I mean, the communication, the advocacy, sometimes just the hand holding, Dr. McDonald, it cannot be understated, the importance of her healing and my own, right? So for me, it was a no-brainer there. I was a junior in high school on a mission, and here we are today. Just to answer your second part, I think it was a PDC, like, right? What do I do? That's a loaded question. It's really, really dynamic. And how I want to answer it is this way. Like, I may spend my AMs, let's do examples. I may spend my AM talking about a workflow for efficiency with adult primary care rooming. I've got several stakeholders involved. Now I've got compliance potentially involved in risk. I've got CPMG, our medical group here in Colorado, involved on, like, this is what I need to see to create this efficiency during the rooming process. We've got HEDIS scores, we've got metrics and dashboards we need to do. The point is nursing services comes in and aligns with all of those stakeholders and says, as a PDC, and says, then let's build it this way. And I will influence this way from a nursing lens standpoint, and then this is how we'll educate the back staff. So there's totally transparency with the medical group, and there's expectations around leadership of what we can build and how we can debrief and checklist. And that curriculum is completely built and influenced by PDC or from nursing services team. I may spend my PM, I'm going to do it this afternoon after this interview here, I may spend my PM rounding one-on-one with staff. I'm here at Wheat Ridge now in Colorado, as you said. And I'm going to ask, how are these workflows going? What about the previous ones we did? There may be a new orientee that I need to discuss, and there is one here. I need to discuss kind of expectations, workforce development, whatever that may be. So lots of swim lanes, but that's good for my personality. I don't know, how yours works as far as sports medicine, but for nursing, the more I feel like we're involved, honestly, the more we can influence and hopefully better patient outcomes. So as a PDC, I'm able to be involved in several things.
That's fantastic. And I think you kind of mentioned two things there. Is one, just the breadth of nursing and the multiple ways that the nursing fields and our various nurses interact with almost every single aspect of our healthcare system, be it in the hospital, be it in the clinic. It's pretty mind-boggling overall too. And so, I, for one, am very grateful for all of our nurses. They definitely have saved my butt on multiple occasions. And I think I always like to say, again, doing sports medicine, I always like to say that medicine is a team sport. And I think it's really important that all those team members are equal members of that effort to improve things and to improve patient care and patient safety as well too. So I had to give a shout out there. The other thing too, which I think you really hit the nail on the head about some of your experience and what drew you to the nursing field in general, is just that amazing ability just to care for your patients and be able to take the time to hold hands. I mean, for example, I'm working in the hospital right now, and I have 12 patients on service, and I have to go see all 12 patients and get the notes done and coordinate with consultants, and I don't have as much time as I'd like just to be at that bedside, just to listen to stories and do that kind of therapeutic bonding and alliance building, which is so critical, especially in the acute setting like a hospital. Whereas our nursing colleagues can do that and are so good at that as well too. I think that's such an important piece of the puzzle. So thank you. Everyone in healthcare has been under a huge amount of stress the past 2 years as well right now. And I think nursing in particular is in critical short supply, given the pandemic and travelers moving to different places of the country to kind of meet the demands as they're coming up. What do you think we can do to make sure we have really well-trained, educated nurses to really meet the demand in our nation at this point?
So great question. Very loaded, right? I mean, I could go aging workforce. I could go patient population growth, no question. I really want, and walk with me. This is going to be, I'm going to try to go deep with it, but I'm going to try to connect to the question. All right. Me, let's see how I do it. Right. So for me, emotional burnouts and empathy fatigue is where I want to stay. I want to go right there. How does that impact the future? Well, this is how it impacts it, in my opinion. What we've seen is we've been unable to get away from COVID, is what I'm trying to say, right? And we're not used to that as registered nurses. We're used to that empathy and giving everything we got right then and there, and then we go home. Social environments, political, religious affiliates. We're hanging out in settings, and we're away from whatever that may be at work. So we're giving, and we got that self-care moment, that work-life balance. With COVID for 2 years, we faced it, and we faced it, and we heard it, and we faced it. We had poor health outcomes, no question about that. I think we both agree there. And then because of that lack of getting away from it, that self-care, that all of that experience, that empathy fatigue, all that stuff, we are at our wits' end a little bit. And I hope I'm not using too much slang there, but I think it's true. Now, here's the answer. I'm going to try. So if you have an unhealthy current workforce, how do you promote a future workforce? You have to start right here, okay? And to do that, there are some steps, I think, and we don't have full 20 minutes for just this, but I think you definitely say, what are the employee resources? How are we describing self-care? How are we describing empathy in our curriculums? How are we discussing connection with members and remembering that self-care is not only essential, but it actually transitions and reflects to what the member experiences, right? So if we're talking about that in our academic institutions, we're promoting that in our orientation packets and talking about debriefing and how do you feel about this or that with each case that we potentially can. Anytime we can, we talk about it. We kudos and spotlighted our huddles. We really discuss and promote within. What that does is Paul used to be a junior in high school. So when Paul sees, and he comes back in and he sees an RN giving everything they got and gets to see a wonderful Dr. named McDonald come in behind Paul, he says, I want to be a part of that. It's not just job security we're selling anymore, it's self-image. our nurses are getting back in communities now, and they're back in the social environments. They're back in those telephone calls, and they're saying, I want them to say, I love what I do. But we have to power within to empower future. That's what we have to do and take care of our own. And look, of course, there's other marketing strategies, but I think for the sake of the conversation, it's all about self-healing right now. We have to get there to basically empower the next generation and say, that's what I want to do right there.
Yeah, that's such a great point, is that empathy piece, and that empathy and that compassion fatigue, which has really impacted so many of us, particularly a lot of our nurses right now too. So definitely a loaded question. So thank you for answering that so adeptly as well. No easy answers, obviously, but I love that idea of starting with empathy and demonstrating why you do what you do and sharing that with the next generation. A lot of studies have shown that actually nursing is one of the most trustworthy members of the healthcare team, in large part because they're able to spend a little bit more time with their patients and build that therapeutic bond. How do you think the nursing field and educators can really embody the importance of that responsibility, not only at the bedside clinically, but just sort of, in larger society? Most people, I think, know a nurse or have a friend who's a nurse, or have, a friend of a friend who's a nurse as well too, which is so important in terms of just giving some guidance and giving some kind of overall messaging when it comes to, overall health or public health, or all multiple aspects. So I guess, sorry, it's a very long question, but how do we really make sure the nursing field is understanding that responsibility?
Well, I think, one, as an educator, I can't ever lose the values that I once had in relation to that member interaction, because it doesn't occur as much, right? And what are those? Well, for me, at minimum, it's advocacy. I can walk hip by hip through the continuum with members, right? And Dr. McDonald, you can say I'm a refer, and I'm going to check back with them, follow up, I'm going to talk to them on the phone. But it's still Paul's voice every time, right? It's my tone, it's my trust I'm building. So if I'm walking hip to hip through the continuum, and I have that responsibility, I have to try to improve through education literacy. How can I expect accountability of our member if they're not literate in their own diagnosis? And then what do I know about diversity in cultural conversations as well, right? That's my own bias. Do I need to check that? So if those are the values at minimum that I'm going to call out, then as an educator, and they're the most trusted profession, no question, the last 20 years. So if I'm going to have that kind of responsibility when I choose this profession, as an educator, my job is to have that same kind of accountability to those nurses, to those LPNs, to those medical assistants, those technicians. If I support you and you're able to call me your PDC, I have to embody that same responsibility. And those kind of things, I think even those conversations sometimes have to be revisited. Like, you have any idea how important you influence and create the trust that we have in the entire healthcare organization at times? You're the first person of contact, you may be the last. So how does that influence our conversations? And honestly, how do I manage up for when Dr. McDonald comes in? These are all things, I think, outside of skill building that we have to internalize as nurses, that we honestly have that kind of influence. And once again, if we look at the last 2 years, there's potentially self-doubt for the first time in the profession. Am I doing the right thing? Why don't my members trust me right now? Why is there so much pushback? But I think that's room for growth. Let's have courageous conversations on how you feel about that if I'm your PDC. And let's also leave room for, how about grace that you're doing the right thing? And once again, trust in the science, trust in what we're doing today, how we're trying to improve, patient healthy outcomes, but embody that responsibility. And if I do that for the PDC, I always say, look, if I am preparing my back staff for empowerment and awareness and responsibility, they're going to reflect that to the member when they see that member. And that's one part of my leadership that I have to respect, and of course honor them as well for how they're learning. So that's how I embody responsibility, and hopefully I'm supporting the staff.
Yeah, and that's such a great point. I have an amazing nurse who I work with here in the clinic, and when she brings a patient in and vitals them and kind of sets them up for, it builds that trust and builds that peace. It makes my job so much easier too. When it comes to whether it be doing their colon cancer screening or their flu shot or the COVID vaccine, the language my nurse uses and the sort of the setup is so important to help build that trust, and then again, part of that team effort where we're all kind of on the same page too. So important. I love it. So tell me a little bit about, the field of nursing has changed a lot in the last several years, even before COVID. What are some of the major changes you've seen, and then where do you think the field of nursing is heading in the future?
That's another great question. For me, it's hard pressed for me not to call out the fact that telephonic platform, virtual platform, and what I usually do to kind of help even support my own bias there, right? I mean, look, when I was in academia, undergrad wise, 10 plus years ago, Dr. McDonald, we didn't have a class on, that was iPhone 1 to laugh at myself and my gray beard here. So it's not like we had this conversation where we're like, you're going to do this in the future, we should talk about it. In other words, there's no curriculums to support. So then I must ask myself, if the conversation really is, we have to meet the member where they want to be met, and that's really our big bubble to converse. Well, then it's like, then how do we support that telephonic, that virtual, potentially in-home, I don't know, type environment? Because it does change, especially if you're talking virtual telephonic. How much objective assessment can I have? How much can I get this history and physical? If I'm going to ask that of my nurses and my back staff, well, then I have to process and say, do we have protocols in place for virtual type settings? Do we have referral consults type? Do we have those in place for disposition? Do I have clinical education that I can provide? Because we want a disposition that potentially is independent as well, right? Those things occur. So there's expectations with that. Then in line with that, what classes are set? What scenarios can I run to really be innovative with my teaching? And then what's the debriefing looks like? What do the metrics show related to safe dispositions versus emergency room after speaking with me as an RN? And so now we have metrics tracking, we have a curriculum to build, and then lastly, we have debriefing. How did it go? Is there a population we need to talk more in depth about that you're not comfortable with? Is there a disease process you want more information on? And then I partner with Dr. McDonald to say, if it's an orthopedic injury, let's do a brunch and learn. He's going to come on to my RNs and talk and say, this is what I expect to see post-surgical. This is what I think is a good thing versus this is what I would bring them back in urgently. Even that empowers from within. Now I've got a physician-RN type relationship where we're conversing about patient healthy outcomes. So in saying that, what I'm really trying to answer is whatever we're going to do, and I'm going to focus on technology there, we have to meet them in where they are. And then it's okay, then how are we setting RNs up for success? Because that's the conversation to be had.
Yeah, that's such a great point. Technology has certainly been on steroids the last couple of years, and likely will not be going anywhere anytime soon. Great. Well, so we have a few more minutes left, so if there's any questions, feel free to drop them in the chat or the Q&A box, and we can try and address any questions you guys have out there right now. You already talked about sort of the empathy fatigue and the compassion fatigue. Tell us, what are some concrete steps that physicians and other healthcare workers can do right now to support nurses in the field of nursing, especially as we enter Nurses Week?
So one, thanks again for having me. This, honestly, even these kind of conversations are wonderful. You have no idea what this does as far as nursing goes. I probably have a ton of colleagues right now in the chat hoping to ask a question to stump me or something. It means a lot, right? So to come full circle, honestly, what I'm saying is it's the want. It's the want to call it out. It's the want to partner. Culture improvement, you have to internalize it yourself and say, do I want to improve the team or empower the team or to create an understanding of a certain operation or diagnosis? Do I want my team to do that every day that I come into work? Do I expect that? If I expect it, how am I supporting it? So nurses, like here's an example. I love examples. We have brunch and learns in one of my specialty departments where really an RN or a physician comes on. They speak at once or maybe once a month or once every 2 months, depending on accessibility and schedules. And what they're saying out loud is, I care what you know about what goes on in the surgical room, or I care what you know about diagnosis and disease process. What that does as RNs is now we have an open forum. We learn, we improve together, we basically are empowering our entire team together, and we're saying out loud, whether providers understand it or not, I want to lead and I want you to lead as well. Let's lead together, and our members will only have, improved outcomes because of that conversation. So I think the more we can just have these kind of conversations, Dr. McDonald, not you and I necessarily, but the more of these conversations, sure, they take place, the better. So thanks for having me with that. That was a great question.
Thank you. That's a perfect sort of kind of wrap up there. So last question, real quick here. Tell us what makes you most proud to be a part of Kaiser Permanente and the work we do to deliver high quality coordinated care and really a team-based environment.
I've never gotten away from the mission. I interviewed based on the mission. I wasn't someone lucky enough to be like, I know 4 or 5 people in Kaiser, they brag about it. I was unfortunate in that sense, and I was missing out after 5 years of service here. Look, accessible, affordable healthcare that improves upstream preventative, care gap type maintenance for the communities. I've never lost sight of that because I think it says so much to why I started back when I was just a junior and I was seeking that out, is like, I got the compassion and care I wanted to see and I wanted to give for the rest of my career, potential life in this profession. And I think Kaiser embodies that, right? I think that is never going to change regardless of technology, regardless of innovation. I think the goal of healthy outcomes at affordable, accessible for our communities, that's what's going to consistently improve health outcomes for everyone that we walk around with in our populations.
Awesome. Well, that was a great wrap up here. Well, thank you so much for talking. I feel like I asked you a lot of loaded questions. You gave me like just a taste of the answer, and we could go on and on. But hopefully, people will continue these conversations within their own organizations and groups and clinics as well too. So thank you so much for having us. Thank you so much for joining us, and thank you, Paul, for joining us as well too. Our next PermanenteDocs Chat is going to be Wednesday, May 18th at 5 p.m. Pacific. Where we'll be discussing mental health with Dr. Maria Koshi from the Permanente Medical Group. So make sure you join us then to talk about mental health. Thanks so much, everyone.